Good morning and welcome to Healthcare for the Homeless. Healthcare for the Homeless is a federally qualified health center focusing on the unique needs and life circumstances of men, women, and children experiencing homelessness. Founded in 1985, we have grown into a provider of integrated health services and permanent supportive housing, recognizing that housing is the most effective way to improve health and end homelessness. Throughout that time, our care has been rooted in the notion of harm reduction, reducing the harm that individuals may be causing to themselves and the broader community until we can get them access to treatment that is not in the United States guaranteed as a right of residency. We are honored to host the tour, the roundtable discussion that we just came from today, and are so excited about the announcement that will take place today. So I will introduce Secretary Xavier Becerra of the U.S. Department of Health and Human Services. We are so excited to welcome you today, and without any further ado, Secretary Becerra.
Thank you. So I'd like to begin by thanking Kevin and all the people at Healthcare for the Homeless for letting us be here. I'm going to remove my mask while I speak, and I've invited the speakers to do the same while they're at the podium. If I can give you a quick sense of the speaking order so you know who we have. Before we begin, let me begin by mentioning that after I make my remarks, Dr. Miriam Delphin-Rittman will be speaking. She is our Assistant Secretary who deals with these issues of mental health and substance use disorder. After Miriam, we will have Congressman David Trone from the state of Maryland, obviously, and someone who can speak from his work and his own personal experiences about this issue. Then we will hear from our Attorney General from the great state of Maryland, Brian Frosh, a dear friend, someone I've had a chance to work with for years. And following him, we will have the dynamic leader of this great city, Brandon Scott, the mayor, who will make some remarks, and then we'll take questions. I will say, please, if we do take questions, we would like you to concentrate your questions on the subject matter of this press conference. If we have time after those questions have been responded to take any other questions, we'll do so. I was going to begin by making some remarks, but I want to read something that was on the wall at the reception area on the second floor here. It says, "It is not as much about who you used to be as it is about who you choose to be." That probably says it as well as any one of us will in terms of why we are here today and why this announcement is so important. It is important to thank the people who make Healthcare for the Homeless work, who make it possible to have signs like that up, because it is their everyday work. It is their tireless effort. It is their constant strength here in the community that helps people not just learn to thrive, but to live. And today, we're talking about something very important because we are in a crisis that has taken too many lives, not just here in Baltimore, but throughout the country. Our nation is right now in the midst of a pandemic of drug disorder and use in ways that leads to harm and in some cases death. Synthetic opioids like fentanyl, stimulants like methamphetamines and cocaine, and other drugs are harming and killing our citizens at an alarming rate. Since 1999, the rate of overdose deaths in America has increased 250%. And the pandemic has only made things worse. In 2020, 93,000 Americans lost their lives because of drug overdose. That's more than a 30% increase from 2019. But numbers don't tell the full story. We see the faces of grieving families and overworked caregivers. We hear it in the blaring sirens, in the panicked 911 calls. We read it in the obituaries of sons and daughters gone too soon because help came too late. One Baltimore resident summed it up by saying this horrifying reality hits home. Every time an ambulance goes by, he thinks, I just hope it's not my sister. For decades, our government tried to stigmatize and punish those with addiction. Stigma doesn't save lives. Stigma induces silence, secrecy, fear. That's why today we're rolling out a strategy that's different, that changes course, and that gives people the help they need. Our new strategy at the Department of Health and Human Services aims to prevent all overdoses. We want to address the full spectrum of drug use and addiction that can result in overdose and perhaps death. Our strategy seeks to eliminate barriers and advance equity, and it reflects the administration's commitment to putting the very individuals who have struggled with addiction in positions of power. Our strategy consists of 4 priorities: primary prevention, harm reduction, evidence-based treatment, and recovery support. All 4 pieces of the strategy are guided by the Biden-Harris administration's commitment to equity. But it's the harm reduction and recovery support aspects of our strategy that I want to highlight right now, because this holistic focus on these strategies is novel and innovative at the federal policymaking level. Overcoming addiction is not easy, and it is rarely something that happens overnight. That's why reducing the chance of harm or death is a critical, I'd say indispensable step in overcoming addiction. Evidence-based harm reduction strategies save lives. Recovery support is equally important, though. For many, recovery is a lifelong process, and I see Odell straight in front of me who will tell you from experience, it is a lifelong process. We want to show our brothers and our sisters, our sons and our daughters, that we're going to be there for them for the long haul, not just when they're on the edge of the cliff, but once they start walking that path of recovery and beyond. Our new strategy should send a loud and clear message. We're serious about tackling this crisis, and we're not naive. This is tough. This takes time. This takes money. It also takes determination, or what I prefer to call ganas, G-A-N-A-S in Spanish. To me, ganas is gut, grit, and game packaged into one. Determination on steroids. We need to have ganas. The time for stigma and blame is over. It's time to arm ourselves with the evidence, partner up, jump out of the box, and do things with champions like Healthcare for the Homeless, and it's time to get to work. With that, let me now ask Dr. Miriam Delphin-Rittman of the department, our agency, SAMHSA, our Assistant Secretary, to please step forward.
Good morning, everyone, and thank you so much, Secretary Becerra, for those powerful words and for your leadership on this important issue. I'd also like to thank Healthcare for the Homeless for hosting us today and for the tremendous work they're doing every day to save lives. As the Secretary said, this crisis has devastated far too many communities for too long. At SAMHSA and across HHS, we're taking a new all-hands-on-deck approach. Through this new strategy, we're focusing on accelerating and expanding access to prevention, intervention, and other supports, while continuing to develop new, innovative solutions, recognizing the social determinants of health contributing to this crisis. We're also targeting efforts towards historically under-resourced populations, including African Americans, who have experienced substantial increases in overdose rates and far higher barriers to care and supports for care. Our new strategy builds on the work this administration has already done over the last year. On primary prevention, HHS is focused on targeting the root causes of substance use disorder. For example, CDC is substantially expanding and updating its 2016 prescription opioid guideline to include evidence-based recommendations for safe and effective use of opioids to treat acute, subacute, and chronic pain. On evidence-based treatments, HHS is focused on the most effective treatments for substance use disorders without delay, stigma, or barriers. We have life-saving medications to treat opioid use disorders, and we're working to expand the workforce to provide these through loan repayments and through the Health Services and Research Administration, or HRSA, and various other venues. On harm reduction, we believe that all people deserve services to promote health and wellness. This includes policies like SAMHSA's allowing federal dollars to be able to purchase fentanyl test strips, considering how to make naloxone widely available, including over-the-counter, and providing $30 million for harm reduction grants to states and localities and community organizations to conduct overdose prevention efforts. On the recovery supports, we recognize that treatment alone is often insufficient to ensure long-term recovery. That's why agencies like SAMHSA, HRSA, CMS are focused on funding, reimbursing, and training workforces for and developing protocols around peer, employment, and housing supports. President Biden's proposed 2022 budget for SAMHSA includes, for the first time in history, a 10% set aside for recovery support services through the Substance Abuse Prevention and Treatment Block Grant. We are excited to break new ground and build on decades of grassroots efforts, and we'll continue to reach out to people on the ground doing this work every day to check in around how our strategy is working. We have to face the facts. The crisis is getting worse, and we need an all-hands-on-deck approach within HHS, complete with concrete actions, a dedicated council within HHS to guide policy making related and behavioral health decisions, and generous funding. As Secretary Becerra said, we must confront this crisis with an all-hands-on-deck approach, because together we can heal our communities and save lives. And now I have the great pleasure to introduce the Acting Director of the ONDCP, Regina LaBelle.
Thank you and good morning. Thank you, Dr. Delphin Rittman, Assistant Secretary, Healthcare for the Homeless, for having us here today. Attorney General Frosch, Congressman Trone, and Mayor Scott. And I think they truly reflect the extent of this issue from the federal level to the local level. As Dr. Delphin Rittman said, it's going to take all of us to do this. So my office is the Office of National Drug Control Policy in the White House. You may have heard of it in the past as the Drug Czar's office. I am the acting director. I think you might see a bit of a difference in this year's director than perhaps in the past. But the one thing that we know is that we have a crisis at hand, and this is a crisis that's not going to be solved overnight. There are 100,000 people in the United States, year over year, by the end of this year, who have lost their life to an overdose death. That's primarily driven by illicit fentanyl. So this strategy today seeks to address that issue, and it accompanies the administration's whole of government approach. Earlier this year, we put forward our first-year drug policy priorities, and there were three things that, not only three things, but there were three really specific items I want to draw to your attention that we were able to get done this year. So one, you'll see fentanyl test strips before you. As Dr. Delphin Rittman said, for the first time, you can now use federal funds to fund those. We encourage people to use as a harm reduction strategy to test your drugs before you use them to make sure you know if there is dangerous, illicitly manufactured fentanyl in your drug. Secondly, we ended a decade-long moratorium on methadone vans, mobile methadone vans, that can bring care to people who need it, wherever they are. And thirdly, we also allowed for prescribers with 30 or fewer patients to prescribe buprenorphine. We heard from people today who are being treated with buprenorphine for their opioid use disorder. These things make a difference, these things save lives, and they are beyond ideological perspectives or partisanship. So today's announcement really expands the Biden-Harris administration's drug policy priorities and the actions that are being taken in every aspect of our federal government. As we've heard, the President's call for bold actions to prevent overdose deaths and overdoses, and his fiscal year 2022 budget calls for $20.6 billion. And that's more than $500 million is included to expand research, prevention, treatment, harm reduction, and recovery support services, all of which are intended to bring down rates of overdose death. because we know to save lives, we have to make sure all Americans, wherever they live, and no matter what their situation, have access to evidence-based prevention, treatment, harm reduction, and recovery services, that we're meeting them where they are. They don't have to come and meet us where we are, and cross certain thresholds. So it's critically important for Congress to fully fund the President's budget. I know that Congressman Trone is working hard on that. Thank you again to Secretary Becerra, and thank you to the City of Baltimore and Healthcare for the Homeless for your hospitality. And with that, I will turn it over to Congressman Trone. Thank you.
Good morning, everybody. Today, I want to first of all again thank the folks here at Healthcare for the Homeless. We had a great tour, but most importantly, we saw a great team. When you have a team that's dedicated, you know you get better results. We certainly saw that here today, and we saw patients that are really making great progress in their life. I want to thank Secretary Becerra for being here and his team. I work with Regina all the time at ONDCP. They're the greatest over there. And of course, we've got our Attorney General Frosh and also our mayor. Thank you again for being here today. But this country, as we finish up with COVID and we all get vaccinated, the next biggest issue facing our country, without question, is the addiction issue in America. As mentioned, over 700,000 people have now died from overdoses. So once these two bills are through, we need to turn our focus in Congress to this area. This issue is personal for me. I lost my 24-year-old nephew, Ian Trone. We spent 5 years working to help him through all types of challenges with depression and issues regarding justice. So my office is focused on really three things: addiction, mental health, and criminal justice. They're all so intertwined, and homelessness cuts right through the middle of all of it. So we've got three things we're working on. The first piece is a commission that was put together by the Department of Defense, which Regina and I sit on together. I'm the co-chair, and it's to stop the fentanyl from China to Mexico to here and come up with demand reduction ideas together. That report will come out after the first of the year. It's an all-of-Congress report, 7 branches of the executive branch, Republicans and Democrats. The second piece is the bipartisan addiction and mental health task force. I'm also a co-chair of that. We have 140 members, Democrats, Republicans. We put together over 70 bills, all bipartisan, which we're moving through Congress now. And the third piece is how we support the Secretary and all of his work through appropriations. I sit on the Appropriations Committee, and this is the #1 issue that we'll be focused on as we look at next year's budget, and COVID is slowly in the rearview mirror. So I can't thank his team for all they've done, and thank you guys for helping remove the stigma to mental health and addiction. Now I'd like to introduce Attorney General Brian Frosh. He's worked for decades to stop the addiction deaths in America. And he's also my favorite Attorney General. Sorry. So, Brian Frosh.
Thank you very much, Congressman. I appreciate that. And when Secretary Becerra was Attorney General, you would have had a much tougher call, believe me. And I want to thank Kevin and everyone at Healthcare for the Homeless. We just had, as others have mentioned, a very informative, interesting, and touching tour. They do an incredibly effective job at dealing with a scourge in the United States of America. They're bringing people back to health, back to life, and it's inspiring to see what you guys are doing. And I also want to thank my friend, Secretary Xavier Becerra. He's a man with vision. He's a man with wisdom. And while I had never heard the term before, I think it aptly describes him. He's a man with ganas. He and when we were both attorneys general, I saw him work in California as I was working in Maryland to prosecute the pill mill operators, the drug traffickers who are preying upon and poisoning their neighbors. And while we did that, and while that's important, we both knew that we're never going to be able to incarcerate or arrest our way out of the crisis that the opioid epidemic has brought upon us. Secretary Becerra and I also worked together as attorneys general to hold accountable the folks who are manufacturing and distributing opioid drugs. They stoked the fires of opioid addiction. They used deceptive marketing tactics that were reckless, and they poured their dangerously addictive medicines into communities all across our state and our nation. We're on the cusp of settlements with many of them that are worth tens of billions of dollars. And we know that the damage that they have done cannot be healed merely by the monies that we will realize from these settlements. As large as they may be, the damage is orders of magnitude greater, and it continues. And that's why the resources and the new ideas that Secretary Becerra has described today are critically important. There's a long road that stretches in front of us in dealing with the problems that this epidemic has wrought. And the health care for the homeless here in Baltimore has got one of the answers, I think, or many of the answers to this, this crisis. We need a multi-pronged approach like the one that Healthcare for the Homeless is implementing in Baltimore, like the one that Secretary Becerra has described that the Department of Health and Human Services is rolling out. So I'm grateful for the work that Healthcare for the Homeless is doing and has done, and grateful for the great work that Secretary Becerra has done and will continue to do. And it is now my pleasure to turn the podium over to the great mayor from the great city of Baltimore, Brandon Scott.
Thank you, Attorney General Frost. And as you know, we are going to miss you and your determination and your dedication to everybody in the state of Maryland, but also those who are less fortunate. But I know that you know our city solicitor very well. If you're looking for a retirement job, I'm pretty sure we can find one for you. And good morning, everyone. I want to thank Secretary Becerra for inviting me here today, but also for choosing Baltimore and to choose to highlight health care for the homeless here as an organization and a city that are getting these services right. Kevin, as always, thank you for your partnership and for your leadership in helping to deal with this critical issue. I want to also express my deepest gratitude to the Department of Health and Human Services and the entire Biden administration for being steadfast partners to work together to battle the drug overdose epidemic here in Baltimore and across the country. Every year in Baltimore, we lose not hundreds, but thousands of people to overdose, fatal overdose. Think about the gravity of that. Think about the amount of pain and trauma that leaves behind for each and every one of those families. And I also want to acknowledge our City Council President, Nick Mosby, who is also a champion for dealing with addiction in the right way. And let me be very clear. Drug addiction is a chronic disease and a public health issue, and it should be treated as such. We know, as we talked about earlier, as we heard from Odell and the fine folks who are using the great services here for many, many moons, right? We have treated those with addiction through a lens of criminal justice, and that was wrong. And as my grandmother would say, if she was here When we know better, we now have to do better. Our residents in Baltimore have been disproportionately affected by this opioid epidemic, and we are losing far too many people. We lose at least 2 people a day in Baltimore to overdose fatalities. And in a city where most of the conversation, and rightfully so, is around violent crime, we are 3 times as likely to have someone die from an overdose in Baltimore. As a city, we need to do everything in our power to save the lives of our residents. And we are here today, along with our partners from all agencies, all levels of government, to say we can and will do better. The opioid epidemic is unprecedented, and our response has to be unprecedented. We have to work together across various levels of government, with our nonprofit partners, dare I say with our private partners, to collaborate with communities to break this cycle and save lives. Traditional strategies alone are not going to decrease the number of fatal overdoses. We know that. We've been doing the same thing, and Secretary, you said it very well earlier, that we get into these lanes of how we should operate, and we don't even realize that we're now in a rut because we have not changed and evolved the way that we think. We have to meet people where they are. We have to remove barriers to treatment by providing access to low-threshold care and offer social and emotional support networks to those struggling with addiction. As Odell said earlier, dealing with the addiction is one thing, but you have to get to the root cause as well. We are working here in Baltimore to scale up those efforts, and we're looking forward to continuing to do that in any way that we can. Like working with organizations like Healthcare to the Homeless to engage in harm reduction practices that work. These items that you see here before you save lives. Yes, they're going to scare folks. Yes, folks have to evolve their way of thinking. Yes, we have to grow in understanding that we have to treat addiction in a different way, but it works, and that's what's the most important thing. We can save lives using Narcan training and more. And what strikes me about cities across the globe where things like overdose prevention sites exist is the lack of overdose deaths. And as I said earlier, if we want to help and save lives of folks, our residents, our neighbors struggling with addiction, the first thing that we have to do is have them be alive. I know how it is. I know how it is to grow up in a neighborhood where we were culturally taught, growing up in Park Heights here in Baltimore, to look down on people who are struggling from addiction. We were raised to think that they weren't even human. And it wasn't until I left Baltimore, grew up, went to college, visited other places, other countries, that I realized that we were doing it wrong. Dehumanizing people and investing in punitive measures in response to this great challenge does not meet our community's needs. It does not save lives. It does not make our neighborhoods more healthy. Reducing stigma in the community and workforce is crucial to preventing people from getting the help and resources that they need. I am glad that we have a federal administration that wants to invest in things that work, data that we know, programs that work, programs that realize that our neighbors who are struggling with addiction are human. They are our parents, they are our brothers, they are our cousins, they are the person next door. We all have the responsibility to work with them to make sure that they are no longer dying alone in their homes or in our alleys, that we are saving their lives and helping them return to the greatest version of themselves. And with that, I will turn it back over to Secretary Becerra.
We will take questions. As I said, please, questions to any of the participants here are focused on today's announcement. And if there's time, if you have questions other than that, we might be able to take them as well.
Okay, I'm going to call on everybody one by one. Please focus your questions on the issue at hand, like the Secretary said at the beginning. Jeff, WMAR2, do you have a question?
My question would be, and I think it might go to the Attorney General perhaps, but when you talk about waiting on massive settlements with the pill companies, is it not realistic to think that money could be turned back in to fund some of these innovative things that we're talking about?
Yes, absolutely. In fact, Maryland's law, sponsored by Delegate Sandy Rosenberg in 2019, requires that funds that the state receives from these settlements be used exclusively for opioid abatement. There's a long list of uses, and we may need to expand those, but it will all be used for opioid abatement.
All right, Phil with the Baltimore Sun, you have a question?
And I don't have anyone in particular to direct this to, but can someone speak to how this strategy addresses wraparound services? I know here in the city, Sun has said that there is still a concern that once someone has a drug overdose and they're admitted to an emergency department, that there's a lack of follow-up once they're released from that emergency department. So I'm curious how this strategy addresses that.
Actually, Miriam, Kevin might be best because they from the federal and then the local level.
Yeah, absolutely. So, a component of the strategy is about evidence-based treatment. And so evidence-based treatments, SAMHSA and HHS, in addition to this strategy, fund a range of services and supports, certainly within Maryland, but across the country, that really constitute those wraparound services and supports that you mentioned. So it's an integral part of that, and there are many different evidence-based treatments within that component of the strategy that we're absolutely interested in helping people get connected to.
Alexa with Fox 45. Oh, sorry, we have somebody wants to jump in.
I'll just address that briefly. Mayor Brandon Scott, in our roundtable discussion, talked about how effective it is to get people into treatment with the wraparound supports that they need, but we have to keep people alive first. We have to keep people from dying. Individuals experiencing homelessness, the majority of our clients, Black and brown, were already dying disproportionately prior to a global pandemic, and the pandemic only heightened that reality. I would suggest that this strategy, look at those four things: recovery support, primary prevention, harm reduction, evidence-based treatment. So many of us on the ground level have felt that we've been at times working against federal strategy based on what we know is effective. This is wind supporting what we know is effective on the ground level. When we talk about, we talked in the small group discussion about how we're doing syringe exchange services. The first syringe services program at a federally qualified health center in Maryland, and the response was, okay, how do we do more of it? When we talk about buprenorphine, the response is, okay, what are the barriers federally that you need to get out of the way? We're having similar conversations across silos with HUD, for example, that says publicly that housing is the solution to homelessness and that housing is healthcare. Buoyed by a strategy like this, I think it lets us work across the various federal silos, that I think there's strong signs of them working more effectively together to let us get out, to first keep people alive, and then get out those wraparound services that we know are effective in getting people off the streets, into housing, and reintegrated into the broader community.
All right, we'll go to Alexa from Fox 45.
Hi, my questions are for the mayor.
And are they related to this subject?
Yes.
Okay.
Two parts to my question. First, dealing with the why, and then the what's being done. Specifically, the state report for Baltimore City showed a 10% increase in the drug and alcohol deaths 2021 compared to 2020. Aside from the pandemic, to what do you attribute that increase? And then specifically, I wanted to know, with the policy change, do you believe that has impacted the path of assistance someone may receive? If that makes sense.
So I think this is for me, actually. Kevin should chime in too, as a service provider. So we know, Alexa, that the pandemic has been driving a lot of the increase, right? People are under tremendous stress. People are losing jobs. People are losing their family members, and that causes a lot of stress for folks. And when you think about how that has increased across the country, as you heard, and not just here in Baltimore City, you have to then think about, again, why. We know that Baltimore has always been a leader in focusing and changing our approaches to harm reduction. The first needle exchange program was here, and what we have to do now is continuing to grow how we meet the needs of for those who are getting service, right? Kevin was talking about earlier, right, the things that they've had to do to adjust because of the pandemic. We, and our health department's been working directly more with folks who are providing those services in our communities. We're trying to build up that community work, those folks who are going out to those people. I myself have been out with folks who have been doing harm reduction approaches in East Baltimore and in West Baltimore, making sure that we're going to where the people are. We have to grow and evolve in how we're doing these services, because while many people will come to a place like healthcare for the homeless, a lot of folks are not at that point. And when you're trying to save people's lives, you have to go to them. And Kevin, I don't want to, if you want to add anything to that.
So do you believe it's only the pandemic that's contributing?
Well, again, when you think about the pandemic, Alexa, it's a broad thing. It's not just the health things of the pandemic. It's that people have lost their jobs. It's that people have lost their family members. It's that people are dealing with pressures that you've never had to deal with before. And we have to look and understand that. Think about how your life has changed since the pandemic arrived and all the extra stress that you have. And when you're talking about folks who were already very vulnerable to have a global pandemic that has taken the lives of so many people. Just over 400 people this year alone have died from COVID in Baltimore City. That is something that's a tremendous amount of trauma, and when you add on that they may have lost their job, the person that died may have been the breadwinner, they may have lost a child, all of those kind of things are very stressful.
But in Baltimore City, with the policy change, do you feel that that has impacted the way someone may have received services?
I think, can you go further than that? Are you trying to say that the services aren't getting to the people, or what?
For example, so the city state's attorney's policy to not prosecute drug possession.
Oh, so you're saying that, did that have more people use drugs? No.
That somebody might receive services.
No, the folks that provide these services provide the services. Healthcare for the homeless, all the other great organizations that help people with addiction in Baltimore are going to help them regardless. This is not for them about political policy. It's about one thing. It's about saving lives. For them, it's about doing that work, and that's where the focus is about saving lives, not worrying about whether this person is using or has an addiction problem, or because someone thinks it's connected to another policy. It's, does this person have an addiction problem? Do they have other issues can we help them with? That's the only thing that matters here. And that's what we're here to talk about today, is how we can save lives, how we can undo, 40, 50 years of a failed war on drugs that we know did nothing. It was really a war on poor black and brown people in this country. It did nothing more to make our city safer. It did nothing more to make our country safer. It did nothing more to help us deal with overdose, because we're dealing with more now than when they started it.
All right, last question. John from the Afro-American.
Yeah, so as I have it, opioid overdose deaths have plateaued, which is quasi-good news, in that white deaths are way down, but all of those deaths have been made up by black people. And so, well, a sizable sum of those reduced numbers. You go to Black Mental Health Alliance or any other experts, and they'll tell you this is an issue of resources. And so, while I'm excited to hear that methadone is, these bans are a positive step, why not Suboxone? Why are you guys cheaping out on us?
I'm happy to answer that. Thank you for your question. So I guess a couple points. One is that we are looking for the medication that works for the individual. That can be Suboxone, that can be methadone. In some cases, it could be naltrexone. There are 3 forms of FDA-approved medication to treat opioid use disorder. We have some for alcohol use disorder. We don't have a vast array for other forms of substance use disorder. But we are not intending to leave the impression that we're only looking at one form. It's really, again, we're meeting people where they are, which means that the healthcare providers have to ask them, is this going to work for you? And so that's really, again, part of our saving lives. Also, I think it's important to point out that the data show that actually overdose deaths for all populations are continuing to rise, but disproportionately, and what we're really focused on at an equity level, is they are disproportionately rising in Black populations, Native American populations. So, we don't have a one-size-fits-all approach, I think, is the bottom line of our approach. Thank you.
So, just to be clear then, I am hearing methadone because you're telling me that because I understand what that is, and that's not to say that this is prescriptive or excluding these other alternatives
Right. If you look at their plan, if you look at other administration policies, we are looking at reducing barriers to all forms of treatment for opioid use disorder. That includes buprenorphine, naltrexone, and methadone. Thanks.
All right, that's a wrap. Thank you.
Can I just add to that real quickly? I want to make sure it's no confusion. We, at HHS, we're not saying no to treatments. We're saying yes to the evidence. And so if the evidence points us in a certain direction, if Healthcare for the Homeless can show us results, we want to follow those results. And so the treatment should be based on what the evidence tells us. And that's a big change. Rather than just say no up front at the federal level and start to deprive communities of a partnership that lets them do more of what works, we're trying to say this is different. We want you to show us the way of what's worked. Let us take a look. You're sitting right next to somebody who deals with data all the time, Rebecca Haffagee in our department, who can say to you, we can break down the numbers of what people are sending to us and tell you if it works. And if it works, we don't want to be get in the way. We want to be partners. And so, as the mayor said, we're all about telling folks, get out of the rut, jump out of the box, and partner up, because we got lives to save. Yeah. We're going to be driven by the evidence, but I think when it comes to Suboxone and some of the other medications that are out there, I think they've proven themselves. The reason we're doing fentanyl strips is because it's proven itself effective in keeping people alive. And so there are certain things that the data has spoken about, the evidence is out, and why should we be resistant or the obstacle to getting things done to save lives? So that's where this is a different strategy. But as I said, it will depend on getting Congressman Chone and his colleagues in Congress to get us more resources. It will depend on having the participation. As Odell had said, you got to respect people when they come through the door. We want to make sure that people are respected, that they have taken the time to say, I'm ready to try to move to a different level, and we want to be there. We don't want to just capture you right before you jump off the cliff. We want to stay with you when you're on that path to full recovery. And so different ways of doing it will take money, will take time, but we think based on the evidence and based on champions like Healthcare for the Homeless, we can get it done.
All right,
You should stop.